Hi, this is MAPE Statewide President Chet Jorgenson. Thanks for joining us for our second COVID-19 Tele-Townhall. 4,000 of you helped us set a MAPE participation record when you joined us last week. We're here again to answer your questions, listen to your concerns, and stand with you during these uncertain times. Please dial *3 with your questions. As we all begin to adjust to this new normal, it is difficult some days to keep up with all that's going on. Yesterday, Governor Tim Walz announced his stay-at-home order. It's hard to believe it was only 2 weeks ago that Governor Walz declared a peacetime emergency to deal with this pandemic. We're so proud of all the work that our MAPE members do in helping to stop and keep Minnesotans safe from this deadly virus. Minnesotans always pitch in during times of crisis, and we're proving once again that state employees always step up. We know how hard everyone is working. Governor Walz knows how hard we're working too. MAPE has many members on the front lines fighting this pandemic. That includes more visible members like the epidemiologists and others at the Department of Health who are analyzing the COVID-19 tests. It also includes those working behind the scenes at MNsure, Minute, DNR, Education, Corrections, and so many other agencies. An agency getting a lot of attention right now is DEED, the Department of Employment and Economic Opportunity. COVID-19 has forced thousands of companies to lay off workers. MAPE members are assisting those Minnesotans who've lost their jobs apply for unemployment insurance. A year ago, we were processing about 2,500 applications a week. This past week, they were processing 2,000 an hour for more than 149,000 applications for the week. We're fortunate to have Melinda Ankeny join us today. She's usually an unemployment insurance auditor with DEED. After telling her boss she wanted to do all she could to help, she answered the call, literally. This week she began traveling from her Cambridge office to the unemployment insurance call center in St. Paul. Melinda, thank you for joining us during your lunch break. I know you have to get back on the phones at noon. Tell us how your first week is going.
Well, thank you very much, Chet, for inviting me on to speak today. I'm very proud of the work that we are doing down here. The first week has been a little chaotic. I'm not sure if chaos is the right word, but it's crazy down here. The phones are ringing nonstop from 8 a.m. to 4:30 and even beyond that, because once people are in queue, we can't just simply let them go. So there were many nights that people were on the phones till about 5:30. We're doing all we can to help Minnesota get through this pandemic. We're here to help people. So like Chet said, we've received 149,000 applications in the first week. With Governor Walz's new stay-at-home order, that is expected to climb within the next week. So I started in the call center 8 years ago, so I'm basically returning back to my roots. I was only in the call center 5 months before I went to field audit. But it's so nice to be able to help people who have all of these questions as to how the unemployment insurance program works, and with all the changes that are coming through and all the new bills and everything being signed, it's been a change, and we don't even have all of the information yet, and people want the answers now. And thankfully, they're very gracious and patient with us so that we can get the correct information to them so that we don't end up giving people information that we don't have yet. So, like I said, I enjoy what I do. I love coming down to St. Paul, as much of a drive as it is for me. I'm helping Minnesota with the help that they need during this crisis.
Okay, thanks. How many of you are in the call center now?
I have no idea. There was a group of us that was called in to help. There's about 25 of us currently sitting in an area that was vacated a year ago. Or about a year and a half ago, we vacated an area down in the First National Bank building, and we've released that space, and there's about 25 of us that are sitting in there now, that some of who have never dealt with unemployment insurance applications before. So they really stepped up too. So we're really proud of those guys who came in not knowing the unemployment insurance program at all. So
that sounds like a really big challenge for those people. How are people's spirits with getting so many calls and having so much work?
The spirits overall, some days are easier than others. Today's been a little challenging. I've had quite a few issues with my phone not working and stuff like that. But overall, spirits are good with all the workers around here. It does get chaotic during the day. By the end of the day, people are exhausted because they just sat on the phone for 8 hours talking nonstop. But overall, spirits are high. They're doing what they can to help Minnesota.
Well, I really want to thank you for joining us today, and please convey to everybody in the call center, all of us for MAPE, how much we care about what you're doing, and thank you for everything that you're doing. And I know you have to get back. We don't want you to get in trouble on your first week. So thanks so much. We really appreciate you joining us.
You're very welcome. Thank you.
For everybody else, please dial *3 to let us know if you have any questions. But before taking your questions, I'm going to turn it over to MAPE's Executive Director, Lina Jamoul. Lina.
Thanks, Chet. Hi, everyone. Welcome. We're happy that you've joined us in this time of that we're all needing to physically distance from one another. At the same time, there's a real hunger for our members to come together. We have a lot of people join us in the Tele-Townhall today, and we're going to continue to find ways to connect with one another in this new reality, so that we can still join members together and continue to build power, continue to have a strong presence, and continue to support people in the workplace issues that you're facing. So what we have been doing is we've really been listening to members. We've been advocating with the administration, and we've been mobilizing our resources to respond to this moment. I want to echo what Chet said earlier. MAPE members really are on the front lines of this pandemic. We are the ones who are keeping state government running, and as Governor Walz has told us repeatedly, Minnesota works because we do. You heard Melinda talk about the claims they are processing of people in Minnesota who have lost their jobs, and unemployment insurance is now the safety net to help people not fall through the cracks, and our members like Melinda and others are there to make sure that doesn't happen. And that's the same with our members in the infectious disease unit who are testing for COVID and are tracking the cases and supporting the healthcare workers through this pandemic. And so this is going to be hard for Minnesotans. People are going to lose their jobs and their income and health insurance. We have members in Minshore who are making sure that citizens of Minnesota don't lose health insurance. So our members are really the glue of the safety net for Minnesota right now, and we as a union are here to support you, to make sure that you're safe, to make sure you know what your rights are, and to make sure that we continue to provide these critical services for Minnesotans. Some of the issues that we're continuing to work with the governor's office and Minnesota management and budget are teleworking, COVID leave, and then safety at work for those who are not able to telework. So I want to recap, and then there's been some new developments since our Tele-Townhall last week that I'd like to go over. So to protect wages, hours, benefits, and other working conditions, we worked with AFSCME and other unions to secure the following provisions for state employees. Guaranteed paid leave will be extended to all staff, to all state employees who must be absent for work due to COVID-19 in order to take care of themselves and their children due to school closures or daycare closures, if they have any of the underlying medical health conditions that puts them at serious risk. So COVID leave, or if you know that you have been exposed to someone who has COVID-19. So COVID leave is a new benefit that we worked in partnership with the governor and MMB to put in place. If you're not sure whether you have underlying health conditions that put you at greater risk, you can go to our COVID-19 website. There's a link to the CDC website there, and the list of conditions are listed. Our last call, one of the things that has changed since our last call is this question of medical documentation. This is a change that happened as of this morning, and we know that there have been some bureaucratic hurdles, unfortunately, false bureaucratic hurdles for the implementation of COVID leave, and we worked hard to get as many of them cleared up as possible. And one of them, the latest one that's been cleared up, is the question of medical documentation. So the state MMB has issued guidance to the state agencies to follow CDC guidelines that medical documentation is not needed in order to grant COVID leave. And the reason for that is because none of us want to overwhelm the healthcare system right now, and that is the CDC guidelines. So if you have previous documentation that you've already have, that would be sufficient. And then if you could just self-certify that what you are stating is accurate, that would also be sufficient. And again, if that continues to be a problem, please reach out to us. We want to know about it, and we want to help you get the rights that you have. The other piece of this is health insurance. The 35-day waiting period for new employees to be eligible for health insurance has been suspended. That means you do not have to wait for 35 days to be enrolled on health insurance. Now, if you, and again, this is a new development since our last call, if you joined state service before the governor signed the executive order on the 35-day waiting period, you will be eligible to enroll in health insurance. You just need to let CGIP know that. So if you fall in that gap of starting state service before the executive order was issued and you don't yet have health insurance, please reach out to CGIP and have them enroll you. And if you have difficulties with that, reach out to us. So we know that you have questions about the COVID leave, and we'll try to answer them on this call. Please dial *3 with your questions. Do we have Lonnie, Roberta? We have Lonnie? Lonnie, yes. Are you on here?
Yes, I am.
Great. Well, MAPE is very fortunate to have dozens of smart and committed stewards working alongside our business agents to support our members. And we're lucky to have Local 701 steward Lonnie Goldsberry with us this afternoon. Lonnie's a training and development specialist with MMB. Lonnie, thanks for being with us today. I know that earlier this week, after numerous emails and phone calls with a member supervisor, you were able to secure COVID leave for one of our members. We'd like to hear about that.
Yeah, so there was a member that I've been working with for several weeks now, and she has some severe health issues. When we got the notice about working from home, she was one of the individuals that they wanted in the office. You can imagine sometimes the relationships between the supervisor and the employee create situations where the supervisors want to watch them more closely. And so she did a pretty good job advocating for herself and trying to get VPN access so that she could continue working remotely. But 2 weeks later, they're still skirting around the issue. And so at some point, I just had to draw a line. Monday she came in, this past Monday she came in to work, and they were wiping all the equipment down because someone had turned up ill. they also had a couple of other individuals in the building who are in quarantine. And so I just had to draw a line and get her out of there. So I sent an email to the ADA coordinator, and this was about 9:07 Monday morning, and I said either they need to get her the VPN immediately so she could telework, or she would have to leave and get paid under the COVID-19 administrative leave. Luckily, the coordinator moved quickly, and she was out of there by 10 a.m. and received a VPN the very next day. So we may still have to make sure that she doesn't get denied that COVID leave for that day that she had to scatter, but we're going to be there. So telework is the new norm in the workplace, and even if and when we're not suffering for a pandemic, the state needs to realize this and outfit the employees so we can serve Minnesotans while telecommuting. Luckily, I have been able to telecommute, and I've been doing more one-on-one trainings as opposed to, say, classroom trainings using Skype and Microsoft Teams. So that's I'm real fortunate that I have a very supportive management team. One of the things I guess we'd like to talk about is a few tips on how to make the experience better for both workers and the supervisors. A big complaint that I hear from members are supervisors who want to micromanage their work. So in this example, she wasn't getting her VPN because they wanted her in the office so that they could watch what she was doing, regardless of the fact that she was a vulnerable person to the COVID virus. So my advice to you is to be proactive and provide like status report or anything before your manager can even ask for it. The way to deal with someone who wants to keep tight rein on you is to anticipate what they're going to ask you for and get there, beat them to the punch. Another tip is I think MAPE members think they always have to explain, and we don't. We have members who get upset in emails and other communications, and I get it. They think if they give their managers all the information, that it will help them understand their individual case. But the sad truth is, if you are experiencing a lack of communication and understanding, chances are that manager, they don't want to understand you. They want you to be wrong. And so with this one member in particular, I provided the guidance. I said, we're not going to answer more than they ask. So they ask a question, don't provide them all this context that you think is going to help them understand. We're going to be concise and direct, but we're going to be direct with flowers. That analogy has actually been working really well, and so let me explain that a little bit. Again, like I said, it's so understandable that we can have communications where we think we know the intention of the manager, and you probably do know the intention of the manager, and it probably is not good. But you can't respond to them with that knowledge. You have to play a level above and dress up what you're going to say with kindness and flowers. So, for example, if they ask you a question, you could say, I please excuse, there was a misunderstanding as opposed to you misunderstood me and I need honesty, right? So get to the point, but what you're doing is you are taking responsibility for any part you have in the conversation, and you're making it palatable for the other person to hear and not feel defensive. Does that make sense?
Yes, that's great, Lottie. That makes total sense. Thank you so much, not only for advocating for our member, but also for the great tips you have about telework. Again, if you have any questions, please press *3, and I'm going to hand it back to Chet now.
Thanks, Lina. Yesterday, Governor Walz issued an executive order asking Minnesotans to stay in their homes unless absolutely necessary for at least 2 weeks, beginning midnight at Friday. There's been just a lot of shifts in the way that we're working and what we have to do. We're going to be talking with the governor's office tomorrow about the specifics of this order, particularly how government employees will be included. But I want to make sure that we spend as much time as we can answering your questions. And also, if we don't get to all of your questions, make sure to check out our continually updated COVID-19 questions and answers document on our webpage at www.mape.org.
Yes, thank you for all the questions you've sent so far. And if you have more questions, please send them to us. If you press *3, we can get your questions queued up here. Chet and I will do our best to answer your questions, and I can start by taking one of them here. Let's see, we have a question about, has there been any discussion on staggering return to work in the office since so many of us have equipment to haul back to the office? Yes, there has been discussion. I don't see which agency you're with, but if you need more information, you can contact us. The agencies have told us that they will work with people to stagger start times, and that indeed is part of the governor's orders to the agencies.
So there's a number of questions about essential workers and kind of comparing what is essential worker now compared to an essential worker during the shutdown. The governor's overall goal is for everybody, to the greatest extent possible, to continue working. I think that it's his belief he doesn't know how long this is going to go. This is not like a shutdown where we could just shut the state down for 2 weeks and then this problem goes away. So his direction to the agencies and to the colleges is for people to telework as much as they possibly can. And so the definition of essential worker is really different than it is in a shutdown. So I think, first of all, the first level is, can you telework at all? The next level is, do you have a job where you cannot accomplish that job without teleworking? For example, you're in a 24-hour operation. And so I think that the way that most of the agencies are handling it at this point that we understand is that as we're coming into this 2-week stay at home, if there's no way that you can telework, absolutely no way whatsoever, then you should be able to use the COVID-19. If there is a way that you can telework, they need to make sure that you're able to telework by the deadline. And so you could be sent home with a laptop if you're not already working from home. There are some jobs that you just can't telework. You can't deliver the mail from home. And those folks will be going home for the next 2 weeks and doing the COVID-19 leave on that. But there's always going to be, make sure that you're talking to your stewards and to your business agents, because it's, especially for the 24-hour operations and the like at Deed, it's going to get a little dicey at times, and so just work with them to kind of help work out the details.
Yeah. And we want to acknowledge that for some of our members, the situation has been really, really challenging because of the nature of your work and the dynamics of the workplace. In particular, the Department of Corrections and the facilities has been a very challenging situation. In unemployment insurance, we know that both because of the work volume, but also the lack of social distancing there, that's been challenging. The career force locations, this morning they issued the call that career force locations are not open to the public, but we know that you've been seeing the public, and that's put both, that's not been, that's a health and safety consideration. The Department of Disability Determination Services and Direct Care and Treatment, these are all areas that we know have particular struggles, and we are advocating as hard as we can, both to your respective agencies and to MMB and to the governor's office to bring resolution to some of these issues. So we've got a question here about our doctor believes we have COVID, but we have not yet had a test. Will we get in trouble if we take COVID leave, but it later turns out we don't have it? So that's there's a number of questions like that about testing. So we know that there are, because of the federal government, there are limitations on testing, and they're only testing folks who may need medical attention or healthcare workers. And so if your doctor has advised you to stay at home, then that should be enough for you to be able to request COVID. Now, if you feel well enough to work, you can request to telework. But if you are sick and even without a test, you can absolutely request COVID leave.
So my coworker Adam asks, what happens with Metro Transit if you're not able to get to work? The first issue is that the state should be having you telework from home. I think then it gets a little bit more murky, because then the issue is, could you actually get to work if you drove? And what are the costs for parking that you'll be facing? We know that we have some of our members who do not have a car, who could not get to work if they weren't able to take the bus or the train. The other issue that could come up is if you have a pre-existing condition where it is really too dangerous for you to go on the bus because of your potential exposure. These are things that you're going to have to work out with your supervisor. Bring in a steward and a business agent as you kind of work through these different levels, and I think that's really about the best answer I can give on that. We've never been through this before, so there's just a lot of things that we've never had to deal with before.
The next question here is about, can you discuss how priority 1 and 2 people can get approved for COVID leave? So some of you may have seen in an earlier executive order, there are some of our folks who are designated priority 1 and 2 workers. And for priority 1 and 2 workers, schools will be open for your kids. And so requesting COVID leave if the schools are closed would not apply to priority 1 and 2 workers, since the schools are open for the priority 1 and 2 workers. However, if you are an individual who is at high risk, or you are suspected to have COVID leave, then you can absolutely apply for COVID leave.
Next question, what happens if the daycare is not closed, but you would prefer to keep your child at home just for the safety? If in order to get the COVID-19, the daycare has to be closed. If you choose to that you want to just stay home because you think it's safer for your child, I don't believe the COVID-19 leave would apply unless you or your child had a pre-existing condition that would make it dangerous for them to be in the daycare. You also mentioned that your spouse is an RN. If your child is below school age, then it would be a daycare. You could take your child to a school if they're at school age. But that's a tough one. And, just thinking if I had a toddler, I would be feeling the exact same way that you would be, like, this is really too dangerous. So the other thing that you can do is telework from home, and you're allowed to have your child.
Yes, and on that, you are also allowed to use COVID leave intermittently. So if you need to use COVID leave for part of the day due to daycare or childcare responsibilities, but you can telework for other parts of the day. That was something that we didn't have clarity on that at the last Tele-Townhall, but this time we do. You are absolutely able to use COVID leave in an intermittent way. There's a question here, a couple of questions more about the COVID leave. One is we're hearing we're not eligible for COVID leave unless approved for it. That's right. HR does need to approve COVID leave, and so they should be doing that quickly. And if you have problems with the approval, either the process or the final decision, please reach out to us.
There's another question from a MAPE member who kind of lives out in a rural area like I do. What happens if the internet access isn't very good? Which is what I experienced also. If you're not able to telecommute and you're being required to telecommute, if it simply doesn't work, it's the state's obligation to get you some type of hotspot or internet that will work so that you can do your work. If you can't do your work, or it's just incredibly slow, and though it would be frustrating, you need to contact your manager or supervisor and just say, look, I can only do half of my normal work or 3/4 of my normal work because the internet is so slow. I think that's what you end up having to do.
Yeah, there's a question here from Harlan. What is the state going to do about informing people that a coworker has been exposed to COVID? That's not clear to us what their internal process is for contacting people who might have been exposed, but we'll definitely ask that on Friday and try to get more information.
Another person, they've got 2 medical notes stating that they need to telework, and you're able to telework. How long is this? What's a reasonable time for HR to approve it? Well, they have till midnight on Friday, and if they don't approve it by midnight on Friday, you will get the COVID leave, the COVID-19 leave, without having to work or out having to telework, and then they will have to get your telework out to you after the 2-week stay-at-home order is expired.
Yeah. There's a question here from Nicole. We all got this email asking us to list our skills so that we might be redeployed. Can you talk about that a bit? Yes. So MMB and the governor's office have given us considerable heads up about the need for redeployment. That could be for a number of different reasons. One of the reasons could be if people just start becoming too ill to come to work in large numbers, and critical services need to be maintained. So I know in the Department of Human Services, they're taking inventory of what are the skills and the licensures. And I will say the redeployment might be necessary not just inside the agency, but across agencies too. And we know that some redeployment has happened already in direct care and treatment. 38 people have been redeployed. Those are folks who are doing dental work, and of course dental work has been suspended. And so they've been 38 people. They're not, MAPE doesn't represent those folks, but those folks have been redeployed in other areas that are needed in direct care and treatment. So we will start to see more of that, and we'll keep you posted as we get more information.
There was a question on there about could HR reverse the COVID-19 leave if your supervisor or manager approved it? Yes, they can. HR always has the right to change your leave slip. It gets to be more complex then in terms of, well, if you can't use the COVID-19, what could you use? But obviously there must be some type of communications problem, and you should push for the COVID-19, get a steward or a business agent to help you with that. We found, unfortunately, that there are some agencies, some HR folks who are not really friendly to the COVID-19 leave, and they're really trying to restrict it. They've given out some misinformation, and so it's really important to stay on top of that and keep in contact with MAPE if you're having any issues.
The question here about, do essential workers need any special documentation to legally drive or transit into work? The answer to that as of yesterday was no. If that changes, we'll let you know, but right now there's no special documentation that's needed to be able to drive or transit to work.
Okay. Can you be retaliated against if you are asking for the COVID leave? There's no reason for them to do that. It's their obligation to find for you to be able to telework, for them to find something for you to do. If you ask for it, if you're ever retaliated about it, please let us know.
Yeah, there's a couple of questions here about priority 1 or 2 or essential workers. I'll take them together. One is, what are we doing to push back on priority 1 or 2 designations? I don't know if your question is because you work in an area where you believe you should be designated an essential worker and you're not, or if you are designated an essential worker and you believe you shouldn't be. I'll speak to both of those scenarios. So we did push for our folks in unemployment insurance and also direct care and treatment who were at first not designated priority 1 or 2, and people's feedback to us was that they needed to be, because priority 1 or 2 employees get access to the schools, and so those folks were included. As Chet was saying earlier, this is a different designation than the shutdown. The shutdown was expected to last for a limited amount of time, where really only essential services, state services, were stood up. This pandemic, if for those who listened to Governor Walz's press conference yesterday, we're expecting it to last 14 weeks or more, and we don't quite know. And so the essential services are categorized quite a bit differently in this situation.
A person is asking, what are the chances of layoffs? So at this time, there's really no reason for a layoff. The state agencies have their budgets. The colleges have their budgets. Some agencies are incurring some additional costs, like DEED, to cover more of the call center. But in theory, the money is there. Could there be a situation where state revenues begin to substantially fall between now and the end of the fiscal year or the beginning of the next fiscal year? That's possible. Governor Walz has suggested that the billion-dollar surplus, or so-called surplus, should be held in reserve to handle any issues with the COVID-19. So as of today, I would say that there shouldn't be any layoffs, but things are changing so fast that, I'm not going to guarantee that through next fall.
Yeah. Well, the next question here is, what if someone's daycare is not closed but want to keep their kids safe and home and don't have a pre-existing condition? Could I still get a doctor's note to protect my kids? Patrick, that's unknown. I would say if you believe that you qualify and you want a request for the COVID leave, to go ahead and do that. They are trying to accommodate as many people as possible to telework, so that is a really good option to use, is to ask for telework agreements.
Another person is asking, is there a limit on the COVID leave? No, we have not. There's not been any official action on the part of the state to say you only get X amount of hours or days of COVID leave.
Yeah, there's the next question here. How do we get guidance on how much COVID leave we can use while teleworking with kids? Struggling to find the balance. I don't want to be working in the middle of the night and need to find the right balance. Absolutely. We've been hearing that from a few different members here. And, you should not be working in the middle of the night. Or super early, 4 a.m. in the morning. That you are a human being. All human beings, we need to take care of ourselves. We need to take care of our loved ones, and the COVID leave is designed to provide just that exact ability. And so, if you could only work 3 hours that day or 5 hours, and you need to use the rest of the time off for COVID leave, you are absolutely not just well within your rights and well within the policy to request that.
Someone is currently on PPL and have other children at home due to the school closures. Do I qualify for COVID leave? That's a hard one. I don't think so, because you're already out on leave. You were going to be home anyway. You can always ask, but I don't know, Lina's kind of shaking. Do you think so? I don't think they could get it to you, Lina.
I don't, and I would say because they're really struggling on how to roll out this leave, and it, as you are hearing from the questions and our experiences, it hasn't been a smooth rollout. It's been pretty clunky, and it's changing. So if you are on paid parental leave, which, operates way more smoothly than this, they have had time to figure out how to implement it, I would advise the safest thing is to stay on your paid parental leave, and if that, once that comes to an end, and if you still need COVID leave, then that would be the time to apply for it.
I just asked for help.
Yeah. Well, there's a question here about hazard pay. Will we be getting hazard pay? We have made the request for both hazard pay and bonus pay to MMB and to the governor's office. We have as Chet said earlier, we have a conference call with them tomorrow, and we will be following up on that request.
Another person says that they have children in daycare and it's open now, but should the daycare close, should they ask for kind of pre-approval for COVID leave? I would definitely talk with your supervisor or manager about that, and because, it's hard telling how much notice you would get for your daycare so that they're not kind of caught off guard. That would be my suggestion. I don't know that you would be able to get it pre-approved, though.
So a redeployment question here. How will decisions be made for individuals who have children at home and or who have family members who have special health needs or risks factors. Our position will be on redeployment that the first efforts should be voluntary, and that they need to consider people's life circumstances when redeploying people. But again, Ed, this is so new to all of us right now that's an unknown question.
There's another question. Has there been any discussion on long-term about for the state to continue work from home for employees? Well, we've had a lot of discussions over the years about folks working from home, and really what this is showing is that in a very short period of time, without having to have a huge amount of paperwork, state employees can work from home. And I think that we will bring that up to MMB and the various agencies and colleges continuously, because as this crisis ends and people start coming back to work, many of you may wish to continue to telework from home at some level, whether it's full-time or part-time, and we certainly are going to advocate that there's absolutely no reason why you shouldn't be able to continue to do that.
Yeah, there's a topic came up today of being reassigned direct care and treatment from an area that is teleworking now. What is our rights if we don't want to go out? There's a couple of parts to that question. One is that we are pushing really hard for telework arrangements to be made in areas that are not being helped to do that. That's the Department of Corrections, Unemployment Insurance, Career Force Locations, Disability Determination Services, and Direct Care and Treatment. So we are going to be pushing on the Governor's Office and MMB to really allow telework anywhere that it is possible, including in these instances. Our members in those areas have really smart and innovative, creative ways of how telework can happen, including rotational schedules in those settings, and so we're going to continue advocating for that. Now, if they're moving you, if they're redeploying you, reassigning you to an area where they deem they need people working there, they have the ability to do that in this peacetime emergency and during this pandemic. If there are health and safety reasons that you have about why you can't be redeployed there, that please contact us and let us know.
The next question, parking fees. Do we still have to pay them? Parking is my favorite subject. Not. We will ask MMB on our call on Friday. I don't know the answer to that. Yeah, there's been some agencies like DHS who found some kind of creative parking solutions, and we'll be taking those, and like Chet said, pushing that on Friday. A question here, I am teleworking, but I'm feeling ill. I don't have enough sick leave, but do not have a diagnosis for COVID. Can my employer force me to take sick leave? If you don't have sick leave, then accrued, then you can't take sick leave. If the employer does feel that you being at work is a health and safety risk for other people, they could put you on paid administrative leave. I don't know what you're sick with, and you don't need to tell us. But if it is COVID related, that means if you're exhibiting symptoms that are like COVID symptoms, or if it's related to any of the underlying health conditions, then you would be qualified for COVID leave. The next question is if the daycares that are open do not meet the needs of a child who has special needs. You cannot be expected to send your child to a place that isn't qualified to take care of your child. Special needs are a pre-existing condition, under the CDC. So, again, they should allow you to telework to the extent that you can. If you can't telework, if you can telework, then, as Lina had mentioned, you can do the COVID intermittently as you're able to care for your child. But if you can't telework and there's nowhere for your child to go, then you should be able to take the COVID-19 leave.
Yeah, there's a couple of questions here about daycare, and this came up earlier too. Can our managers, supervisors require us to work alternate hours instead of COVID leave when working with our kids to help them with distance learning? You know, again, it's we understand that, and it is a priority to keep the state services going, and that we are the people who do that work. And Minnesota Minnesota works because we do. So we get that, and I know everyone's doing their best. At the same time, we're human beings that need to take care of ourselves and our families, and so COVID leave was designed for people to be able to do that during this pandemic. And it sounds like we are hearing more and more about either late work or early work or alternate hours. And so we're going to bring that to MMB this Friday and really ask them to clarify to supervisors that this telework arrangement doesn't mean, you're like busy 16 hours a day trying to juggle childcare and your normal workload. That is not a viable, sustainable solution.
We're getting close to running out of time. I'm just going to try and skip around and see some questions that we haven't addressed. Someone has asked if because of teleworking, I don't have enough to do, that I don't have 40 hours to telework. And this is more common than we think because a lot of the state is still on paper, still does paper instead of everything electronically. You need to let your supervisor know. Don't just work 30 hours and say, okay, that's all the work I had. You need to say, okay, I've done all the work I can today. I've done all the work that you've given me for the week. What do you want me to do?
Yeah, so it looks like we are out of time. Do we have time for one more question? One more question. Okay. You want to pick which question to answer, Chet? We're reading through these because many of these are repeat or areas that we've already covered. What does legal quarantine and legal isolation mean?
So under the law, the Department of Health, some government authority can tell you, you have a disease, you have something, and we are ordering you into quarantine. And so the law specifically states that if you are ordered into quarantine, your employer cannot discriminate against you. This is a little bit different in that the Department of Health doesn't have time to order everyone who has a temperature or exhibiting any of the symptoms of COVID-19 to quarantine. And so the governor is asking people to self-quarantine. This is why we're applying, trying to work with the governor's office to make sure that agencies and colleges are not being overly restrictive on this so that someone is saying, look, I'm just going to, you're not telling me, you're telling me that I'm not sick enough for COVID leave. Fine, I'm coming into work. That is what we don't want. We want people who have any of the symptoms to quarantine based on the criteria from the Minnesota Department of Health, based on what your doctor says, not based on how much sick leave you have.
Yes, and I'm going to sneak one in. If you are pregnant and denied COVID leave, please contact us. You should not be forced to choose between your job and your health. Being pregnant is one of the underlying health risks according to the CDC guidelines. So if you're pregnant and you're being denied COVID leave, we will fight that.
members with children in daycares that are closed can't use COVID leave to keep their kids home. No, they can. And if you're having any problems, contact us at MAPE, contact your business agent or a steward. Just go to the MAPE webpage. You can track them down. If your daycare is closed, you get COVID-19 leave. And in fact, even one of the people who we've been meeting with at Minnesota Management and Budget has said they understand that people cannot send their kids to the normal backup babysitters who are grandparents because grandparents shouldn't be exposed.
Yes.
Well,
thank
you. We've run out. In fact, we've gone over a little bit over time. I'm being told to stop. But thank you so much. Thank you for coming to our Tele-Townhall. We will continue to stay in contact with you as much as we can. And thank you for everything you do.
Yes. We are continually updating the COVID-19 questions and answer document on our website at mape.org. There is a special COVID-19 tab that you can go to, and if you have additional questions, please email them to us at action@mape.org. Thank you so much for joining us and for all the work that you do day in, day out for Minnesotans.